Good morning. Good morning, everyone. Good morning, ladies and gentlemen. That honor us with your audience today. Welcome to the regulatory webinar, Quality in Times of Pandemic. Today we have two distinguished speakers that will address the challenges and opportunities of operating in times of pandemic. Before we start today, I want to let you know some housekeeping items. This is my role. I only have to do it. When it was at the hotel, I could tell you where the exit door was. Today, I don't know. I don't have an exit door. But anyway, first, for the participants, you are going to be able to ask questions for the speakers. We will have a session, a Q&A session at 10:30. Please, I'm sorry, somebody is distracting me, but anyway, please send your questions at the following email. You will see the email right there. So the email you have on your screen, you can send your questions there. We will convey the message, the questions for the speakers. Second, we will broadcast polls to obtain information about performance today. We want to use these polls to improve future webinars and conferences. As everyone is doing in time of pandemic, we are learning how to innovate using the new tools available to us. So please forgive us if we have some whoops in the process. Now I have the pleasure to introduce PIA's Board of Directors Chairwoman and Managing Director of Merck Commercial Operations, Ms. Wendy Perry. Wendy, please.
Thank you, Rafa. Can you hear me? Can you hear me well?
Yes, we can.
So good morning, everyone. And I'm truly enjoying this introduction from Rafael because it's a clear demonstration that we all can learn to live in this new reality. So Rafael has come a long way, but he has embraced the technology. Let me rest assured that he has done that. So thank you, Rafael. Thank you for helping us and putting all this together. And as president of the Pharmaceutical Industry Association of Puerto Rico, it is my pleasure to welcome you all to our regulatory webinar. With innovation as our compliance enhancer, our agenda today will heighten the importance of quality in times of pandemic. At PIA, our mission is to drive an environment that strengthens Puerto Rico's biopharmaceutical industry's competitiveness and improve healthcare outcomes for our citizens. With a track record of more than 60 years, Puerto Rico is one of the most sophisticated biosciences ecosystems, with one of the best track record of FDA compliance and quality in manufacturing and best launches of first-line products. This is possible because the highly specialized human capital in the biosciences that ranks among the best in the US according to Bio. Puerto Rico's reliant state-of-the-art biopharma infrastructure was proven during recent storms and earthquakes, and without no stockouts, and many plants operating during the Category 5 storm, our business was reestablished within 2 weeks. Puerto Rico is the largest drug exporter of any state by supplying critical products to over 100 countries. This activity is possible thanks to the robust and resilient biopharmaceutical ecosystem and supply chain, always ensuring that quality continues to be the foundation that allows patients and consumers to have confidence in the safety and effectiveness of our medications and vaccines. We may already be a US pharmaceutical powerhouse, but we are ready to leverage our assets to make the country even safer and more secure from global disruptions like COVID-19. We are committed to making sure that every American can have access to high quality and most effective drugs and vaccines. In this endeavor, our members and affiliates work hand in hand with the government, regulatory agencies, and all stakeholders to drive an environment that strengthens our biopharmaceutical footprint. To protect and preserve our reputation of quality, we develop conferences like this to continue at the forefront of the latest trends. Thanks to our guest speaker for joining us and for your contribution to our continuous learning. To all of you, thanks for accepting our invitation, and I hope you all have a very productive day. Now, back to Kisha.
Thank you, Wendy. And again, good morning and welcome to all. Just a few words to get us going here on this webinar. Certainly 2020 has been a year that we did not plan for. Nevertheless, we have stepped up to this moment in history by reinventing ourselves in our personal and professional lives. Faced with the challenge of this pandemic, as an industry, we have tackled it by learning and innovating along the way. Always committed to our primary responsibility of caring for the well-being of our patients and ensuring the safe and reliable supply of medicines to those who depend on us. As the pandemic unfolded, we immediately implemented practices to safeguard our workforce and community. We have demonstrated agility in adapting our business processes to ensure the reliable supply and product quality by maximizing our electronic tools and virtual settings, amongst other things. This has allowed us to stay connected to our operations, shareholders, regulators, and customers. The list can go on, and I'm sure all of you have multiple examples of similar efforts. But this has only been possible thanks to our true heroes, our people, who continue to show up every single day, giving their best, yet in the midst of a pandemic. On behalf of PIA, thank you for all you do for Puerto Rico and the biopharmaceutical industry. You have demonstrated resiliency, adaptability, a committed passion for what you do to make life better for people around the world. I am so proud to be a part of you. To our colleagues at PIA and the Quality Committee, thanks for coming together, as always, in support of PIA's mission. Please take the time and enjoy this webinar. And without further ado, I would like to introduce our first speaker, a familiar face to PIA and this regulatory conference, Mr. Alonso Cruz. Mr. Alonso Cruz is Director, Office of Pharmaceutical Quality Operations within the FDA Office of Regulatory Affairs. His office is responsible for all pharmaceutical quality inspections and investigations, working in conjunction with FDA's Center of Drug Evaluation and Research and Center for Veterinary Medicine. Additionally, Mr. Cruz continues to lead AURA's pharmaceutical collaboration efforts under the Program Alignment Initiative. Previously, Mr. Cruz served as the Director of the Office of Medical Products and Tobacco Operations and Director of the Los Angeles District Office, where his responsibilities included providing executive leadership to implementing, managing, and evaluating FDA's regulatory operations. Mr. Cruz first joined AURA in 1983 as a microbiologist. He received his Bachelor of Science degree in Medical Technology from York College. Please welcome our first speaker, Mr. Alonso Cruz.
Hey, good morning all, and whenever I start Okay, good morning. I heard like an echo. Anyway, before I start any video meeting, I want to make sure that the audio is good. Can you hear me? Okay, great. I see at least one head shaking. First of all, I want to thank PIA for the kind invitation to be with you all this morning. Sort of out of full disclosure, I'm actually not in Maryland right now. I'm actually in California. And so it's a little early in the morning, but don't worry, you didn't get me up any earlier. As I tell my team back east that if they're at work, I'm at work. I do try to keep East Coast hours, so it keeps me in a similar rhythm. I don't have to change too much in my day. You are so right, Wendy. We are certainly in new and I like to look at sort of exhilarating times, because it's giving us an opportunity to think a little differently from where we are and what we need to do. I just a little public time, a little public notice here. So the slides, if you could just go back to the first slide, and I'll let you know when to change to the next slide. I should be on my title slide right now. Okay, thank you. We are certainly, what was strange just a few months ago is now today's norms. Here I'm able to reach out and engage with peer and the firms and people in Puerto Rico, all while at home in California. Virtual now sort of like the new conference format. Social distancing is some could say as the new face-to-face when we do get together. Before I jump in, I want to sort of just touch upon a small piece of history. And it's always like I tell people, like, history always has a way of teaching us things or helping us to understand things. Although not known by its present name until 1930, FDA's modern regulatory functions began with the passage, as you all know, of the 1906 Pure Food and Drug Act, which took really over 25 years in the making, that prohibited interstate commerce then of adulterated, misbranded food and drugs, and has been certainly a driving force behind this law in its early years of the enforcement, providing some basic elements for protection that consumers at the time had not seen before. Right? And I know we've had a lot of amendments in the pharmaceutical space. Not only did drugs have to be safe, they had to be proven to be effective. Well, since then, FDA has certainly changed along with the times, whether social, economic, political, and legal challenges and changes within the United States. Examining that history of some of these changes, I think really speaks to the evolving role and adaptation that FDA has played in promoting not only public health, but also offers us real-time, lessons that we should consider as we evaluate our current regulatory challenges. And certainly the backdrop on why we're here today, why we're even engaging in this type of a format, is challenges associated with COVID-19. Next slide, please. ORA's mission, certainly protecting consumers and enhancing public health by maximizing FDA's regulated products, all while we're trying to minimize risk. Our public health and mission strive for those outcomes, and we look at them as shared, as it's critical that we appropriately partner with regulated industry to help us realize that full intent. A reduction in dependence on any one country is key for pharmaceutical and our national security. And certainly the pharmaceutical industry in Puerto Rico plays a major role in that. Industry owns primary responsibility to ensure, excuse me, reliability products are safe. The medical products, excuse me, the medical products industry that we regulate must adhere to current good manufacturing requirements and practices. For example, operating procedures, manufacturing, sanitation, processing controls are certainly a few of the subjects and, that we look to, along with certain reporting requirements at their facilities. We look to be and hope to be considered partners in this shared responsibility to ensure safe, quality, effective medical products accessible to patients. Whenever I tell my staff, and they've certainly heard me say this enough, that I was at a meeting and I asked them one time, well, what do you do? And, you know, I'm an investigator, I'm a drug specialist, I'm a compliance officer, I'm an administrative support person, or what have you. And I remember remarking at that time, I thought I was in a room of some very smart people, yet no one knows what they do. And I found it surprising. I even went to supervisors and some of my leadership team, and they too relied to their title. And I had to remind them, we are more than a title. I like to look at it as that we provide access to safe medicines. And it doesn't matter what title you carry in that perspective. If you keep that in the back of your mind, that speaks to the essence of what we need to bring to this table. All right, next slide, please. Sorry about that. ORA is certainly at the forefront of building a public health safety net for today's complex regulatory global environment. And certainly ORA plays a key role in that global process. Early on, when the coronavirus started really getting more and more prominent, as you would imagine, you know, more than half of my inspectional work is done overseas. And so we had a lot of concern that was raised early on about where our investigators have been and where they are going next. And I'll get into that in a moment. Certainly we have trained investigators that are that work in some of our overseas offices, predominantly in from the drug side in our China office and our India office. We do have an office in Latin America as well, but we don't have any drug investigators there. And certainly the inspectorate that is US based, that is performing international inspections. We keep an active, we play an active role in international engagement with organizations such as the Pharmaceutical Inspectorate Cooperation Scheme, conducting international audits, working with them and others on mutual reliance. And certainly we are engaged with the European Union with the implementation of the mutual recognition agreement that went into effect back in November 2017. We're playing a leading role on mutual alliance activities, as I mentioned, with not only EU as well, but with the UK, along with our Office of Global Policy and Strategy, and also in cooperation with the various drug centers, biologics, or various medical product centers, I should say, because it's more than just a drug space. We certainly share with some of our trusted regulatory partners, inspectional findings and other regulatory information. And this has been key as we have been navigating the work that we've been doing through the pandemic. Excuse me. Next slide, please. Okay, now, as you would imagine, we've had to certainly curtail some of our activities. So in a more normal year, and I guess I could go to 2019 as a more normal year, you would have had numbers around what you are seeing in the slide here. Okay, here we go. the inspectional work that we do, and I'm just going to highlight, just pick on one piece right now, in the generic space, represents about 1/3 of the overall inspections that we conducted in 2019. It plays a big role for the amount of work that we are doing in that activity. But we did do over 1,000 foreign inspections, and I'll say for the first time, we conducted actually more than 300 inspections in the country of India. So we really began ramping up as we've been able to bring people on and get training accomplished in that space. I don't have specific numbers for FY20 because we had stopped inspections. Now I'll go into that. We postponed inspections rather, but I'll go into that in a little while. But some of the things I want to mention regarding some commitments that we had made regarding a couple of metrics, public metrics. As you know, we actually about 3 years ago now, we had worked on providing a classification, inspection classification, to the manufacturing sites that we conducted. And we had pledged at that time that we would issue those classification letters within 90 days of the close of the inspection. While we understand that it's important for firms to really know, well, how exactly is FDA going to classify my inspection? Yes, I know I was with the team while they were there, and we had the appropriate closeouts, but I'm still not sure, and we made a commitment to provide that information. But let me just sort of show you, because we actually implemented that a year ahead of schedule, and we had some really good timing in that particular metric. So for FY19, we had about a 5% improvement over the previous year, which was about 82% of the letters were issued within 90 days. And this year we had, FY19 rather, we had 87% of those letters that were issued within 90 days. Now that 90 days were the metric. The vast majority of those were issued within 40 to 45 days, and really a major improvement in what we're trying to step up. We're actually working to get that number that we issue within 90 days, a classification letter, in excess of 90%. And we are certainly on target to do that. Another one of those public metrics that we had initiated about 3 years ago was dealt with the rate of the pace at which we would issue, when appropriate, a regulatory action. Those being either import alerts, warning letters, or significant regulatory meetings. And we had a metric that within, let me see if I can get this right, within 90 days of issuance of the decision letter, that we would have, and when appropriate again, a regulatory action issued. Because, you know, we certainly understand that if you get if we issue a speeding ticket, and I'm using this as an analogy now, but if we issue a speeding ticket 2 years after the offense, it's going to have little impact on whether or not I still continue to speed or not. That wasn't an admission of guilt that I'm speeding. I'm just using as an example. Okay. So we've seen a 16% increase, improvement in that, in which over 90% of those enforcement actions were issued within 180 days of the close of the inspection. Again, just a major focus on really trying to be timely and transparent in our activities. And I just wanted to share that piece with you. Next slide, please. Okay, certainly at the onset of this public health emergency, resulting in what we all know today as a coronavirus pandemic, travel restrictions and the continued outbreak pose not only a difficulty in the thinking then of our public health activities, but certainly our interactions and engagement with firms. As a result of these issues and policies, many of which implemented at firms, restricting visitors, pose a serious challenge for us in accomplishing the ways we used to do it. And I'm saying it like that intentionally. In March, FDA announced a temporary postponement of foreign and domestic surveillance inspections because from a public health perspective, we're deeply and certainly remain committed to the responsibilities of protecting and preserving life. And it was certainly important for us that we not only ensure the safety of staff, but really the staff of the greater good, not only firms, but our neighbors and others as well. We certainly recognize that the need to balance protection of our workforce and those that we regulate. And we certainly didn't want to be a spreader of COVID-19 because of unnecessary travel. So we postponed routine surveillance. We postponed inspections in that space. Importantly, all domestic at the time for-cause inspections were evaluated, and we have been moving forward on those that have been deemed what we refer to as mission critical, and really those that generally focused on applications that were breakthrough therapies, especially if it was COVID related therapeutics, again, related to COVID, or other really high profile drug or other issues or anything sort of associated with that. As an example, we had a mission critical inspection overseas in our northern border that dealt with hand sanitizers. Again, this was very early in the beginning of the pandemic, in which there was a severe shortage of hand sanitizers. Importantly, during this sort of interim period, we've been looking at other ways to conduct our inspectional work that would not jeopardize public health, certainly would not jeopardize safety of staff at firm or FDA. And we are robustly employing and using some of those authorities that allow us to accomplish work in ways that we had not previously thought deeply enough about. And certainly things such as using authorities from FDASIA 706, such as requesting records in advance or in lieu of inspections. I know we've done that somewhat in the past, but the pandemic has certainly skyrocketed how we are using those things when travel is not permissible or appropriate. This is certainly continue to allow us to make some risk-informed decisions that helps us focus when we are on site and when necessary. Next slide, please. All right. As this remains an ongoing and dynamic situation, we continue to assess and calibrate our approach as we are beginning to resume postponed inspections as feasible. In addition to work that that was not accomplished or could not be accomplished by alternative means, we certainly have new work that has resulted from COVID. Certainly things like working with and working on emergency use authorizations, EUAs, pre-site visits for sites who are potentially making COVID-specific related therapeutics and or vaccines. And we are working to resume those operations that will be both strategic benefit as we calculate the risk of our inspectional force. Well, how are we going about doing this? We're certainly using a data-driven risk assessment system that allows us to apply a strategic benefit risk calculus to our inspectional work in terms of where our staff goes and where we are and where they're coming from, if you will. ORA, we're continuously monitoring our advisory system as we have begun resuming prioritized surveillance on-site inspections as a use of our sort of matrix advisory tool. And factors within that tool are dependent on the virus's trajectory in any given locality, rules and guidances that were put in place by any local and state authorities. Our matrix tool is updated. We get a reading twice a week, and it's based on counties. And so it's red, yellow, and green. Green is, they have all the downward trending, available hospital space, number of positive cases, and all of that has been trending downward for a period of 2 weeks or longer. Yellow is, getting there, not quite there, and red is certainly areas in which we have not been moving to do returning of routine prioritized surveillance inspections. One of the things that we realize is that now with a workforce of 17,000+ essentially working from home, we had to also factor in where people lived in this process. So we had to overlay within our matrix tool where employees' homes were and the counties that they lived in. So if we had a firm as a part of our prioritized model that was in green or yellow, but we only had employees that were red, we still would not do that site because we didn't have the staff living in an area in which we could do the work. Green and yellow we were looking to do, and red we were not doing. All right, so that's in the prioritized inspections. Those inspections that I mentioned earlier that were deemed mission critical, and there have been a handful. It's not like we've done 50 of those. On those inspections, even if it was in red, we still would seek a volunteer to go about doing those. And we also had 2 mission critical inspections that were overseas, and we actually have another one that's scheduled for later on this year. All right, so what else have we done as a result of this pandemic? To facilitate inspections and continue the commitment of protection of health and safety of product and people, we are contacting industry partners and firms prior to inspections to insist in combining our efforts to adhere to safety measures recommended by the Center for Disease Control and Prevention and really state and local authorities. That's right, we are pre-announcing all of our inspections as a result of COVID. We also want to ensure that our regulatory oversight activities are conducted in a manner that will minimize disruption to industry. We certainly recognize that firms may have done things, social distancing, reducing their staff, and we want to be sure that that we are certainly abiding and not being a burden in that scope. And certainly we want to adhere to all the provisions adopted due to COVID-19. An investigator will call in advance. We have a number of things we sort of go through, backgrounding information, questions about activities that are going on in the facility. And certainly we also learn of your safety protocols associated with COVID-19. Our intent is to minimize our on-time presence at the facilities to minimize exposure and risk. Next slide, please. All right. So what are we doing? What are we learning here? Certainly inspections are just one of the compliance tools that the agency uses to help our risk-informed strategy managing quality and safety of marketed products, in addition to overseeing the importation, safe importation of regulated commodities, and to help prevent products that do not meet those standards from entering the United States. FDA is using a number of tools. Considering the unprecedented workload and changing priorities that have resulted in our response from COVID-19, the agency is keeping up with our user fee commitments, and that performance is commensurate with previous years. Now, I would never have imagined, I don't think any of us would have imagined, just a year ago, that we would be first confronted with something like this, and really the speed and pace at which we had to adapt to be able to continue to remain active and productive during this period. I think that's a testament to the will and the strength of the I'll say first the American people, but certainly the global the global people in this aspect. Next slide, please. Certainly, beyond inspections, beyond import alerts, heightened screening at borders, utilizing the risk-based matrix, we're using all of those things and looking to innovate in ways that we have not done so at a pace in which we have not probably done so in the past. FDA remains committed to using all available tools in this process, whether it's through records requests. We have been increasingly examining and exploring using virtual and video inspections. We have met with some of our EU partners to get a better sense on their experiences with it. We have internal with the FDA a number of studies and usage using some other virtual technologies. Just yesterday, I got information from two companies who are working and developing technologies in that space. So it is something that we are working quite rapidly on being able to really explore beyond the confines of a brick and mortar type facility to be able to make a critical care assessment of quality operations that may be conducted within. Next slide, please. We continue to, as I mentioned, look to facilitate operations to achieve not only regulatory activities, but really to touch upon those things that are impactful to industry. And we really would be open and really looking to some of the things that we can possibly do in that space. We remain totally committed to continuing improvements in those areas, and not only strengthening that internal coordination and expanding our coordination and engagement, but also increasing collaboration on how do we figure this out together. This pandemic didn't impact part of what we are; it impacted everything on who we are, and really, only working together will we be able to meet these challenges. Continuing to adopt regulatory efficiencies certainly is going to require new thinking. And as I tell my staff sometimes, we have to get out of our way if we want to move forward, whether it's using new tools, leveraging technologies, and even leveraging relationships with others we have not. Now, I never realized there were so many, before at FDA, we would either use WebEx or occasionally Skype for meetings. And since March, I've used WebEx, certainly Skype, Adobe, GoToMeeting, GoToWebinar, Zoom, and Teams. It's probably more out there, and but I just wouldn't have imagined it, in those things before. And we have to, just as we adopted to virtual being the new conference format, we have to really look on how we can not only get our message out, but really look to how can we leverage those activities so that we don't skip a beat in what we have to do, whether in a facility, whether it's in the planning process, or really, quite frankly, any place along the way. In that space. And we don't want to be duplicative in that work. And we are certainly in this together and engaging with our partners, regulatory partners overseas. One of the things, as another example, the MRA, when it first was established, was between the work that was done within the EU versus the work that was done within the US, and we would sort of share that work. And if the a EU member country did an inspection outside of the EU country, that was not within scope. So we've been referring to that as sort of third country, right? The MRA country is doing work in another country, and can we, or should we, leverage that work that they're doing? The can we, yes. The should we, yes. And we're looking at that. We're looking and working with our regulatory partners at PICS in that space. Like I said, we are really accelerating those collaborations and really looking at ways in which we can further enhance the use of those things. Next slide, please. Get this out of my way. I already mentioned sort of benchmarking against other inspectorates that we are, and how we sort of identify and look at new ways on approving the work. I've been sort of signaling all along open, honest dialogue about true partnerships and really advancing that medical product quality. One of the things that has been sort of something that throughout my entire time with the FDA, I've always valued the importance of regulatory education and collaboration throughout this process. And certainly, what can we do to help us both achieve those things in new, creative, and quite frankly, I'm okay with never have been done before issues in that aspect. And I think if we can't find the ways to do those things now, we'll probably never be able to find them. And I think that just really that blue sky type thinking will help us to achieve those things. Next slide, please. All right, so I'm coming to the end here. I think this may be my next to last slide here. Certainly, understanding from the FDA perspective, how has this pandemic changed the pharmaceutical industry, right? What are some of the things that we may not be aware of that are different in terms of how industry is going about research, planning, sourcing of raw materials, the supply chain? How are those things changing? And what can we do to first understand and facilitate some of those positive changes? Identify how we're going to work towards achieving those outcomes to the best interest of here it says American people, but I'll say global people, because this pandemic cannot be solved in one country alone, because the world is global and there is a lot of interaction back and forth across our borders. And engaging in ways in which we strengthen those partnerships and other activities. I did miss coming to Puerto Rico, and wherever I go someplace that has a beach, I always gather sand, and I keep that sand in little jars and things around my office, because it reminds me of when I stuck my big toe in water in another part of the world. So I do have sand from Puerto Rico, and it is proudly displayed within my office. So with that, I think this is my last slide, but I'll just say next slide. I think this was the last one. Yes, it was. Okay. So I want to thank Pia for, again, the kind invitation, for being with you here this morning, and looking forward to the rest of the discussion. As you can see, it's starting to get light behind me. It was dark at 6 o'clock in the morning, so it's getting light outside. Thank you.
Alonso, thanks a lot for making time for us. I know times are very challenging these days. People moving around, it's not easy to coordinate, but you always, you are very gracious with us. We really enjoy your presentations. Anyway, thanks again. And we hope that next year we'll have the activity in Puerto Rico. You'll be here again.
Looking forward to it.
So now I have the pleasure to introduce Dr. Anthony Myers-Louis. I think he likes to be called Tony, and he is the head of global quality at AstraZeneca. He worked previously for Amgen and other organizations. He has done a lot of work in different activities in the National Institute of Biological Standards and Control at the UK, and at that time he specialized in the development of assays for the characterization and quantification of biological products. Again, as I said about Alonso, Tony is also a great friend of Pia. He's always willing to come, leave everything behind and come and talk to the Pia people in Puerto Rico and to the industry people in Puerto Rico. We thank you a lot, Tony. So with you, Anthony Myers-Louis.
Great, thank you. So I also want to thank Pia for inviting me to speak at this webinar. I think it will be an interesting discussion. So if we move to the first slide, I'm going to talk about the industry side of how we were managing quality under the constraints of the pandemic. So if we move to the next slide. There we go. So for me, I was thinking about what would summarize one word in how we were dealing with the potential problems we might see under the pandemic issues. And I really chose the word focus, because what we really needed to do was primarily, and not surprisingly, keep our workforce safe, to make sure that they were safe and healthy and that we didn't spread the virus across all our manufacturing sites, because as you can imagine, then we would have had to close them down and end supply. So putting the workforce first, I think, was one of the important roles that we had to do. Oh, the slide has disappeared. I should wait for it to reappear.
So sorry. Right there. No.
There we go. Ish.
There we go.
Yeah, so that's fine. I can speak to it as it is. So as you can imagine, of course, when we were working out what our priorities going to be, it was to focus the work that needed to get done for ensuring quality and compliance and manufacture and supply to patients. We also had to think about people's well-being, because as you can imagine, either working from home or working under the new rules that we had within our plants, you know, everybody wearing masks, one-way systems, social distancing, that can be quite stressful on people. So we had to make sure that our workforce's well-being was being considered, and we'll talk about that a bit later. Communication was essential, making sure that we had the workforce continuously communicated with. And then decision-making. You can imagine, and you heard Alonso talk about that, there wasn't time to hang around trying to make decisions. They had to be considered in a risk-based approach and made rapidly to make sure that we could continue supply to our patients. And we've always had a focus on lean in the world of AstraZeneca and in operations, but we needed to add that focus to make sure that we were reducing waste, that we were focusing on doing the right thing, getting it right first time, to make sure we could meet the demands of the supply chain. Next slide, please. And you've seen this version of this slide before, is where are you going to be focusing? And the most important place to focus are the operators, those people who are actually on the floor, in the lab, people who are releasing product. So those that actually are making the product and ensuring that it's getting out the door. And I think that was one of the biggest decisions, the most important decisions we made right at the beginning of the pandemic, that by keeping the operators free from distractions, making sure that we were working directly with them, keeping them healthy and making sure they could get their job done, I think made the biggest difference in ensuring our supply to patients. If you move to the next slide. So we had to change our leadership focus. So first of all, we had to trust the staff that were on the floor doing their job. We had to make sure that they were empowered to make decisions. We couldn't have it that every decision that needed to be made had to be pushed up the managerial chain. It just wasn't the time to do so, mainly because in addition to the fact that the operators were on the line under new conditions, most of the managers are actually at home. We were non-essential staff, which is an interesting term for most of us, but we just basically weren't there. You know, we had to keep away from the plant to make sure that only critical folks were actually in there. We then had to make sure, as I mentioned, that the decision-making was taken at the right level, that we allowed empowerment of across that inverted triangle, the right people were making the right decisions. We also heard Alonso talk about virtual technology. It was amazing how rapidly we engaged with virtual technology. We moved in AstraZeneca onto using Teams basically within a week, and the whole company was using it. And again, it was really interesting how new technology was adopted in such a rapid measure, and everybody was using it. So that was the way we had to engage with staff where we weren't directly next to them. And we'll talk about that a bit later, about how we made sure the virtual technology was reaching all the way down through the organization directly to the operators. We also had less Gemba distraction. Ivan, could you go on mute, please? Could you go on mute? We can hear you. But there was less Gemba distraction because we needed to make sure that the operators were more comfortable doing their job without people continuously coming on the line to do Gembas, to do process confirmation, that sort of thing. We had to prioritize to not do that. And of course, everybody had to be open to new ideas and to change. We couldn't wait to do the full change management programs that we would normally do. This had to be one where leadership had to understand the changes and the new ideas and be open to adopting them as quick as possible. We needed to have resource flexibility to make sure that we were focusing on the right places at the right time. And as you can imagine, as the pandemic opened up, we had to be thinking about the products we were making, the timings of that making, how we were going to distribute them appropriately as borders were opening and closing. We had to make sure that we were flexible with our resources. And of course, we had to make sure we had very strong business continuity plans based on the data that we knew at the time that was constantly being updated. Next slide, please. And we had to drive prioritization. As you can imagine, we're always very busy, but we had to make sure that we focused on what was the most important things to do to ensure supply to patients. So business as usual, as we call it, which is, making the product, testing the product, and releasing the product became our priority. All of us have projects that we do, projects that come from corporate, projects that can be done by the teams for continuous improvement. We had to look at those and say, you know what, which are the ones that actually helped business as usual? Which ones were the highest priorities? So we could have less diversion of staff on projects and more onto actually getting product out the door. And we had to use that by looking at our supply priorities. We tried to eliminate as much waste as we possibly could in our processes. It's amazing how something like a pandemic can immediately identify things that we do not believe are value added. And that information comes all the way through from the operators, all the way up the leadership chain. And we made sure that we were reducing that waste as much as possible. And at the site itself, it was less above site distractions and projects. As I say, corporate groups are pushing into the sites. They had to be held off. Next slide. So if there was one message on what we wanted to do, was allow those folks that are doing the critical task to make products, was to get rid of those distractions. So that actually was the task for the leaders, the managers, the frontline facilitators, to remove the distractions as much as we could for our staff to allow them to get onto our jobs. Next slide. So how did we create that appropriate working environment for everybody? So both for on-site and working from home, it was to create a quieter, less distracting environment. We all attend many meetings in our jobs, and it was to remove those meetings that weren't relevant, to make sure that there wasn't stuff going on that created distractions for our staff. We had to improve the way we increased our interactions with our colleagues. As you can imagine, if you're working from home, we had to come up with ways to think, how can I improve my interactions in a virtual world compared to being able to walk down a corridor and speak directly to somebody? How does a manager who's working from home work with staff that are actually at the site? So we had to rethink the way we interact with folks. The cross-functional engagement, again, was very important. As I say, because we started working more virtually, you couldn't necessarily get to see your cross-functional colleagues. So we had to have an improved dialogue across the company to make sure that we were doing those prioritized activities. I mentioned previously resource flexibility. The same thing was with schedules. We had to be flexible depending on what the pandemic situation was telling us we had to do, which products had to be made, where they were going, shifting around the priorities within the manufacturing space, as well as other projects that were going on. We had to be flexible around the timing for these things. And really following standard work practices. This was the time, and I mentioned this before around lean, is to really stick to those standard best practices that we had to make sure that we were always going to be right first time as much as we possibly could. And we wanted the workforce to challenge us and challenge the status quo and say no when necessary. If we were putting too much of a burden on them, we gave them the right to say, no, this is too much. Or to say, you know what, these changes that you're making, maybe you could come up with another way of doing them. If we were making too restrictive an environment for them to work in, yes, we had to protect them, but also we needed to let them get on with their jobs. So we gave them the empowerment to say no when necessary to some of the things we were asking them to do. As I say, if there was a project that was coming down from corporate and it wasn't relevant for them to do their day job, we allowed them to say, no, we're going to push this off till the pandemic is over. And of course, very important for our workforce is we had to ensure work-life balance. I was so proud of the way all our teams stood up to the challenges that the pandemic gave to them. And many people did work many longer hours to ensure supply to patients. But we had to ensure that people also had a work-life balance so that we weren't tipping it too much in the work way. because, you know, the well-being of our staff is very important as well. Next slide. And as I mentioned, all of us spend many of our lives in meetings, and we had to really beef up the meeting discipline that we had to make sure that we allowed people to have their jobs. Now, meetings are important. We have to be sharing information. We have to be understanding what is going, decisions may have to be made at these meetings. And we actually have a decision-making model called DAI that we use in operations, which really drives discipline in when you need meetings, how you have agendas for meetings, you have pre-reads, so that the meeting is all about making the decision. It's not sitting there reading loads of PowerPoints. So when you go to a meeting under the DAI model, you've already pre-read the details of what you're coming into the meeting for. You understand who are the right people that are going to be there. You have people that give you the right advice, and you pick who is the decision maker, which meant that you come to a meeting, you're already prepared, you have the discussion, you know what the decision is you need to make, you know who the decision maker is, you make the decision, and then you're done. Just because a meeting may be scheduled for an hour does not mean you spend the whole hour just because it's there. Once the decision is made, you decide who you have to inform and you move on. We also used a lot of quality risk management tools. Risk management was very important at this time to do the highlight of which ones are the important tasks that we should be working on and which ones are not so relevant. And as I mentioned, using that DAI model, we actually had less meetings because we only focused on those ones that we felt were top priority. And we actually defined blocks of time in people's days where we were allowed to have meetings, and the rest of the time was no meeting time that people were allowed to go and do their work. Now, the interesting thing about working virtually is you don't worry about room conflicts. There's no time traveling to and from different buildings, from different rooms. So ironically, we did leverage the virtual meetings, which I think have actually worked very well and has become almost the future way of working that I think most of our companies and the agency themselves may well be doing. So, and also I think our ability to improve our communications, I think, has made a big difference. That we were working virtually and trying to make sure that we could understand what is on people's minds. And when we made decisions, to really explain them so everybody could understand what was happening in the organization. Because the last thing you want in a pandemic environment is to have confusion. So driving good communication, I think, was something that we all understood we had to do. And using effective meetings and decision-making really drove the ability to communicate better than maybe we had been in the past. So next slide. And we've all talked about virtual meetings, but that really wasn't the only piece of the digital solutions that we adopted, and it had to be adopted rapidly. So, you know, in several parts of operations, we used a lot of paper still, and we had paper signatures, you know, people wet signatures on bits of paper. Well, you couldn't do that if people were, for instance, were working at home, or people just weren't available to hand off bits of paper for and to be moving it around the organization. So it's amazing that we'd already started using DocuSign, but once the pandemic came on, it was pushed throughout the organization. And there is a Part 11 version of DocuSign, so it's all GMP approved, and the rapid uptake made a huge difference, not only in timing, but actually in, when you think about it, sustainability. There isn't so much paper floating around and the storage and worrying where it's gone, because it can all be done electronically, straight into our quality systems and our document management systems. As Alonso said, we all implemented the Teams and Zoom meetings in a very rapid manner. It was pushed out into the organization, onto our laptops and our iPads, and everybody's basically got used to that way of working now. And as I mentioned, we had to build those connections with the operators. Now, operators on the line or in the lab, not everybody has, not surprisingly, their own personal computer sitting in manufacturing on the floor or in the lab. So we provided iPads to all the frontline operators in the labs, on the floor in manufacturing, so they had direct contact themselves to information, to procedures, and their managers, in fact, because you can have meetings on iPads through Teams and Zoom. So by giving them this technology, every single person in our organization was now able to be communicated to in a rapid manner. And they very much appreciated it, and I think it made a big difference in the way we were doing business. We pushed the use of augmented reality for tech transfers. People weren't allowed to travel from site to site, from country to country. We now implemented augmented reality. So you could do tech transfers of assays, you could do tech transfers of the production of all sorts of things, manufacturing systems, simply by putting on these glasses, these Google-type glasses, and somebody at a receiving site can watch somebody at the sending site actually doing their job. And it made a huge difference, not only in speed, but the ability to do our jobs without travel. So you can imagine it's something that I'm sure will be adopted throughout our industry as travel, for all sorts of reasons, for cost, for sustainability, is likely to not return to the levels we've done before. Is this augmented reality has made a huge difference on the way we do business. We have virtual tier boards. As part of Lean, we're always monitoring what is going on in our manufacturing plants and with our groups across the organization. And we all used to stand in front of the tier boards in the morning and see how we're progressing. Well, with social distancing and people working at home, we couldn't do that anymore. So we developed virtual tier boards. And again, the adoption of that technology has now worked its way throughout operations. And again, if you can't be at a site because you're a manager that's working from home, how do you get in touch with our people? Could you do any Gembas around the site? So we've adopted people literally using their iPhones and a gimbal that allows you to walk around in a plant without actually being there, but seeing virtually what is going on in the plant and being able to ask questions and check in that everybody's doing all right. And again, we're thinking maybe that is something that we will do more frequently rather than jumping on a plane and visiting other parts of the organization. So it's really exciting actually how the pandemic has driven the uptake of very useful digital solutions. And I think there's going to be many more of those moving forward. Next slide. So as Alonso mentioned, hosting virtual inspections. Oh, no, there's creating the culture one, missed that one. So creating the culture. As we know, culture is extremely important for everything, for quality culture, compliance culture. And we had to create that culture to ensure that our teams were doing well. And it was to create that culture of increased helpfulness, team spirit and collaboration. We were all in it together, whether we were working from home or we were we were in the plants themselves. It's amazing how people really pull together with the spirit of we need to get our medicines out to patients. And so everybody was helping each other. People were supporting each other if there was childcare issues or we needed to get, for instance, we were helping operators by providing some basic amenities that would help them if they were under lockdown and it wasn't easy to go shopping, that sort of stuff. People came up with some great ideas on how to make people's lives easier. Quality really had to focus being as a partner to facilitate the manufacturing, to make sure that not only was supply compliant, but we were there to be helping, to make sure we were on the front line, to make sure we weren't there as the police, that we were there as partners helping the front line to do their jobs. And so being there at the time to be able to answer questions and help folks. We developed virtual social interactions. If people are working at home and they're sitting, in their offices or in their front rooms or their dining rooms or whatever for hours on end, you can lose track of having those social interactions because people weren't able to go to the coffee machine and have a chat. People weren't able to go to other people's desks. So for well-being, we created these virtual chat times where we just said, you know what, and I do it with my senior leadership team, is let's meet for an hour once a week and we're not going to talk about work. We're You're just going to talk about how you're doing, what's happening, how you're feeling, that sort of thing. And it's actually really made, I think, more space for those sorts of social interactions that maybe we had in the past. So again, I think another thing that will probably continue as we move forward. I mentioned before this willingness to take up new ways of working and technology. You know, sometimes change management is not always that quick. You know, if you think about the steps of change management, each one has its own specific reason for doing it, but it can also take time. And so we had to change that culture to say, you know what, we may not have done it this way before, but let's have a go. And that good enough approach, you know, nothing is always going to have to be perfect, but you know what, let's do it. Let's have that 80-20 rule. Take a few more risks. And you know what, if it doesn't work, let's stop it and let's do something else. But if it does work, start in a small area that where if you do find it's not working properly, it's not going to have a big impact. But if it does work, scale across the organization and do it quickly. And that really was part of how we managed to adopt a lot of this technology. Small pilot, see if it works. If it works, great. Everybody then adopts it without question. And I think that's worked really well. And that links to having a sense of urgency in a burning platform. You know, clearly in a pandemic, you have to have a sense of urgency. There wasn't time to hang around having loads of meetings to talk about what we should be doing. It was, as I mentioned, that rapid decision making, the good enough approach, the fact that we have to get medicines out to patients. And I think everybody really rose to that challenge. And of course, trust. You know, we had to trust each other to do the right thing, to speak up if they saw something that wasn't working well or wasn't going right. And I think that the whole organization really stood up for that. As I say, been very proud of how, you know, across the organization, that people have really stood up and done a great job. Next slide. So, as Alonso mentioned, clearly a lot of agencies are now doing these virtual inspections. And as I'm sure Alonso can appreciate, what goes on behind the scenes at a company preparing for these inspections is actually a ton of work. Because when an inspector asks for information, they don't want to be sitting there waiting for hours for stuff to get in front of them. And it's hard enough when you're actually there and you have a back room that can get the questions from the inspectors, can find the documents and make sure they're recorded and get out. Virtually, it's even more complicated. And this is just an example just to see how complicated it is to set up who's speaking to whom based on a team's way of working to make sure that we have the right people in the right place who can communicate with each other. As you can see, even with Zoom meetings, occasionally things can happen. People can pop up when they shouldn't be popping up. Slides can go awry. People can, go off mute and start talking and disturb people. It wasn't easy. And we had to create the environment and guides for the sites on what is the best way to set up an MS Teams channel as an example. And how do you interact, especially if you have more than one inspector. If there's one inspector, maybe it's a bit easier, but we've had inspections where there may be 3 or 4, each one on their own MS Teams because they were working from home. And so that really complicated the way you had to set these things up, but we did it. As I say, our teams rose to the challenge. We had to make sure that the way we were working was appropriate to have the right SMEs being able to hear what was going on without, as I say, disturbing the audit itself. How did we share information? So, as you can imagine, because the inspectors aren't on site, we were having a mix of pre-recorded videos that we could provide them. We had these virtual tours where the inspector can be led around, for instance, a laboratory or a manufacturing floor. They can ask questions. How are we going to organize that? And then how do you make sure, for instance, in open meetings of the morning where you wanted all the inspectors in the same room versus then separating them and then teams coming in and out, how do you do that with this type of technology? As I say, it seems reasonably simple, but you know what? We needed those technical experts to make sure that we weren't confusing everybody with this type of stuff. So next slide. So some of the best practices and things we had to work with were actually different formats. And it'd be great if everybody was on MS Teams. But as Alonso mentioned, there are multiple different types of communication technology that's out there. There's Teams, there's Skype, there's Zoom, and there's several more like that. And we found that with some regulatory authorities, they weren't all working on Teams. And in fact, we had one inspection where there were two inspectors, one of which was working on Teams and the other one which was working on Zoom. And their computers could not cope with using both. So you can imagine the poor site was pulling its hair out going, oh God, how are we going to manage this? But they did, but it's things you've got to prepare for. And also inspectors in different jurisdictions were asked for different things. Some were working very much by email. Some were working live. Some they would request, just could you send us a whole load of pre-recorded videos and we'll get back to you. So it really has been a balance depending on the type of inspections and regulators that we were dealing with. We created a COVID-19 position paper because most of the inspectors would ask, so how are you dealing with the pandemic? What has your position been around that? What sort of risk assessments have you been doing? So we made sure those are always prepared for the inspectors. We had to make sure that the inspectors knew that we were still continuing a version of our self-inspection program and that we had documentation around that. We couldn't say, oh, sorry, there's a pandemic, all our auditors are going to stop work and down tools. We had to do our own version of self-inspections with virtual tools, being able to look at the quality systems and read documents for our own internal programs. And again, we will ask questions around that by the inspectors. And then making sure that we had more than one host in the virtual rooms, because there were times when a question would be asked and a host would have to leave to go somewhere in the virtual space to deal with that question, which, when you're in an actual physical room with people, you can have people coming out, you have the scribes and you have the folks that work backwards and forwards. It's much harder to do that virtually. So we actually have two hosts with an inspector so that if the question is needed and the host has to go away, the inspector isn't just sitting there staring at a blank screen. The SME prep was important too, because again, there's nobody sitting in the room listening to the progress of the discussions with the inspector to be prepared should a technical question be being asked. So we had to make sure that the SMEs can hear what is going on so that if a subject matter came up, something about aseptic processing, something about pest control, the right SME could go, oh yeah, I can hear that coming, I'll be able to answer that question. And then also, how do you chat between folks in an audit? Because you do need to say, oh, they're requesting this, or could you call in somebody into the meeting, that type of thing. So what we've done is to make sure that things don't keep on popping up on screens in the actual, for instance, MS Teams part, we would use Skype as an example for using chatting. So we used a completely separate system that meant that we weren't having crossover between the audit rooms and the other rooms. So hopefully you found all those bits of information useful. And I always like this picture of the last slide is, manufacturing in an organization, if you want to go to the last slide, is not easy. And at the time when the pandemic hit, we were all going, wow, are we actually going to manage this? But I say, I'm very proud of AstraZeneca, and I know the rest of the pharmaceutical industry has done very well to make sure, as best to our ability, that we've managed to supply every patient every time. So thank you very much, and look forward to any questions you might have.
Okay, we're gonna run. Okay, we're gonna run a short poll for our audience. We'd like to have some feedback, and after we do this, a few minutes, we'll come back with the questions for our distinguished panelists. So I'll let it go for like 1 or 2 minutes, so everyone can respond. And I like the very good. Thank you. Really, as I said at the beginning, this is a huge exercise in terms of we've never done this before. It's not very easy to do. It requires a lot of interaction, but I like the opportunity to share this type of information with our members and our viewers. And we really like to, if we have enough topics, we really like to do other webinars, maybe more specific webinars. So if you provide the feedback about what type of meetings, what type of topics would you like to see in the future, we really like to receive. You can send them at the email that we set up at webinar at pr.org, the one that you are using for the questions. We'd really like to receive the feedback. Okay, so lo podemos dejar así, ¿verdad? All right, good. We see we have around 100 guests online, and a good portion of them are doing us the favor of answering the poll. So thank you very much, guys, for doing this. So now I will continue with the Q&A. Tony, we have a question for you. What has been, or it has been, the biggest challenge in the quality aspect on time of pandemic? How have they been overcome, and what has been the benefit of the new ways of working?
I think the biggest challenge was ensuring the appropriate communication between the operators, the quality folks on the floor, the people in the labs, and those working from home. Because as you can imagine, we had a whole chunk of people that all of a sudden moved home. And it was a new way of working for quality because, for instance, those roles that normally are very site-based, that many people were then working from home. So how do you build that communication where a release officer who can work virtually is no longer actually at the site themselves? So for me, it was the quality, the organization really got together very early on to say, how are we going to manage these roles and responsibilities? Who are those essential folks of quality that really need to be on the site with the front line? And prioritize who should be working at home, what sort of rotas should we be doing. I think the DocuSign adoption made a big difference because we initially had a lot of people in quality who had to be on site because we were dealing with lots of paper. Once the DocuSign implementation came on, it allowed more people to work from home because they could do their job virtually. So for me, it was communication and really deciding on who are those quality folks that are critical to the day-to-day supply. And it's kind of interesting, you think we know that, but it's only when something like this happens, you have to differentiate everybody between day-to-day activities and above-site activities. So I think it was really the selection of roles, who should be on site, who is essential and not essential, and then make sure those communication channels were kept open through the pandemic.
We have another question. It looks like one of your AstraZeneca teammates. So, hi Tony, thank you for a great presentation. Among the areas to focus on your presentation, how do you foresee the lean culture mindset on cross-collaboration between regulatory agencies and pharma sector? And how can you assure that all regulatory agencies have a good understanding of the lean tools on changes and evolution that have been done to simplify the way we do things for the benefit of patients?
No, it's a great question, of course, and I'll ask Alonso to contribute too, because I think, you know, Lean, Six Sigma, those ways of working, I think are becoming the mainstay in our industry now. Because, Lean involves a lot of those concepts that the regulations do. So a lot of the ICH regulations around risk management, the quality systems themselves. I mean, quality systems are designed, if you really think about Lean, for continuous improvement. And the agency is always expecting companies to be in continuous improvement. If you have a deviation, the expectation is that you do a really thorough investigation, get to root cause, understand what the root cause is, the true root cause, put the appropriate cappers in to fix it, and then check that they were actually effective. And, you know, it's always interesting to me that sometimes people associate Lean and Six Sigma as just being, oh, you know, it's just a set of tools, it's around efficiency and that sort of stuff. But it's not. Lean is a mindset. And I've always said Lean and quality are essentially the same thing. It's about improving your processes, doing the right thing, enabling communication, removing waste. So, you know, we've always said that Lean is licensed to operate. Now, I'm sure in the agency themselves, and Alonso can comment on that, I know they've been looking into those tools and those processes and that sort of thing. Now, do we share exactly the same levels of training? Maybe it is something that we, but Alonso, maybe you could comment on what's been done in the agency.
All right, certainly, thank you for that. And yes, continuous improvement is one of those sort of foundational activities that we are looking at. Just in my office of Pharmaceutical Quality Operations, I do have a staff, a QMS, quality management system, quality management staff, helping us even with our own internal operations, that we are about continuous improvement. As a matter of fact, there's one of mine, what I call my pharma tenets, that speaks to just that. And the global pandemic that we find ourselves in is really helping us to advance those activities. I really appreciated in your slides with the fast fail issue, because if there's no time that you could ever consider doing, it's right now. You have to, and that's really has helped us to really advance. Now, I know the government is a big bureaucracy and it's a machine that moves very, very slow. And I can tell you, just in the 6 months or so that we have been in this type of environment, we have accelerated in undertaking things that we would never have been able to do short of a pandemic, if you will. One of the things, just to go slightly a little beyond, now I mentioned earlier that we had met with regulators to get a better sense of the virtual inspection that they did, actually of a facility in the US, not in Puerto Rico, but in the US, in the continental, I'll say. And so we only got the perspective from a regulator. I really listened with intent on the complexities seen from the other side, and that was an important piece to hear. So much so that I may either be following up with you, Anthony, or certainly with the trade to get a better sense of that impact, because that graphic was very graphic in understanding of the impact. You're right, virtual and the tools and some of the other things. Just for the record, we were looking to all use the same tool with firms, not somebody on one thing and someone on something else. So, but anyway, it was a good perspective on that. And again, listening with, I always tell my staff, I got to listen sometimes with my third ear. That third ear speaks to that continuous improvement activities. And I think those are the things, whether Lean, Six Sigma, Yvonne, or my staff who heads these efforts for me, has to have us continuously looking, and then drilling down to staff for their understanding, implementation, and how do we record and correct as we're building this plane.
Okay. I have another question for Alonso. Are the FDI, is the LTA will continue with the approach of unannounced inspections, or the pandemic will coordinate at least with a time frame?
Okay, so that's really a good question, and it's one that I've heard before, and certainly I'll answer it. I'll answer it this way. There will likely be inspections that are unannounced, right? And those may fall into categories of following up on a criminal nature. It may be something to see. If I say all these things, if you get an unannounced inspection, you're going to say, oh my God, it must be one of those categories. It may be associated with things that we should be unannounced on. Our stance right now and our opportunity right now is to conduct, is to pre-announce our inspections, those that are international, which were previously already announced for planning logistics, as well as domestic. And this is, so we are looking at impact of pre-announcing our inspections right now. Since we're really just resuming, it's certainly too soon to tell the outcome or what the findings are with that. This may become a best practice moving past COVID. But right now, this is what we're looking at and what we're doing. And to be frank, once we socialize and get used to something, and there's really no overwhelming reason to say, or any overwhelming evidence to show that it's detrimental, it's likely to continue. But again, we're doing it now as a result of out of extreme safety and precaution. And even if when a vaccine is ultimately developed and approved, we still have time for distribution and actual implementation and usage. So we're in this right now, and I do not see, as I'm sitting here today, if and when we will stop on pre-announcement. And again, hey, even today, there are going to be inspections that don't get pre-announced. But again, the premise is about public safety right now.
Okay, thank you. I believe this question is for you, Alonso. So if not, you let me know.
Okay. If it's not for me, I'll change my name back to Anthony. On
excellent, excellent. I don't know how you did that, but you did it.
I use Zoom a lot, so I'm familiar with this.
Knowing the complexity of regulatory requirements, what would be the best way to reach out to local pharmaceutical production companies to identify opportunities in order to begin exploring this packaging or injected molded part?
Okay, so if I'm understanding the question, very specific to an issue, and sounds like a more tech review in that activities. Now, I would, so while we are working virtual, the points of contact that a site may have had with a local district office still continue to reach out through that office. All of the offices have sort of a general email account, if you will. We've not changed that, and certainly if there is a specific issue or question or subject matter expert that's either within my office or within office in Cedar, I'll certainly connect you to that appropriate resource. We are looking at site visits still and pre-site visits when appropriate in this space. So we are still looking to continue our site engagement program with manufacturing facilities, maybe somewhat different, use of more tech and other tools like that, but we're still continuing those programs. And if you need a specific contact for that particular issue, just let me know, drop me an email, and we'll get somebody back to you.
Thank you. Alonso, can you provide more details on the risk-based process used to determine inspection priorities?
Yes. So we have developed a GIS-based tool, and it looks at a number of factors. As I mentioned, it looks at trajectory of cases from a number of data sources, CDC NIH, National Governors Association. They have a really good website that really tracks cases within states by county, and as well as local and municipality authorities. So all of that information is really creating a color-coded risk model for us. It's GIS based, so it's where a particular firm is and what the trajectory is based on with the data received from those data sources in that aspect. So it's not based on a site. So I'm going to use AstraZeneca, Anthony, because you're here with me. It's not like, oh, that particular site at AstraZeneca is problematic in terms of its COVID issues. It's looking at a county. So it's all of the facilities that are in that county. So on the GIS model that we have developed, we can sort by firm type. And I say firm type, it's like food firms, pharmaceutical firms, biologic device, if you will, facilities as a filter. And so when we put that in, and it's based on the county they're in, not necessarily the state. So a state can be raging out of control and would be what we call red, right? And not political, but red as in number of cases. And, but there are certain counties within that state that have a good control over issues within their county. That state may have a designation of yellow or green. And the green is just the number of cases that they have. Yellows between a certain parameter, and certainly red is greater than a certain number. I don't have the metrics up in front of me to give a specific number on what they mean, but red, yellow, green, essentially. And we're looking at, as we're returning to do inspections, to look at staff that's residing in a green or yellow to a facility that's in a green or yellow county, and to be able to prioritize those inspections to get done. And like I said, when the tool was developed and the beginning of the rollout, it was just so unfortunate. There was like a major increase of number of cases, and it really had the country go, you know, most of the counties, greater than 80%, close to 90%, went back to being red. The last time I looked at the matrix model last week, we were about 78% were red, about almost 20%. No, it was almost 20% yellow, about 7% green, and the remainder were red. So it's been slowly getting better for us to get out there, and we have been increasing the number of prioritized inspections as a result. But again, all of those inspections will have received a pre-announcement phone call in which we're sort of going through a number of questions to better understand the operations that have gone on at that facility.
Alonso, can you comment on how many virtual inspections have been conducted in Puerto Rico?
Virtual inspections?
Virtual inspections, yeah.
Okay, we have not conducted any virtual inspections. We have been requesting records requests. As of, I want to say about 2 weeks ago, since the start, we have requested over 420 or so records. We have, let me just see if I can quickly pull up a quick quick stat on that. We have, and we have, you know, the records request is not sort of a futile, just a keep busy type of activity. We have been making decisions based on the work that we have been as a result of the records request. Let me just give a quick, just a quick update on the. And again, this is just a rough estimates in this space. For pre-approval foreign, we have, there have been 72 approval recommendations. And again, it's just a recommendation from my office, and 11 withhold recommendations. That's pre-approval on the foreign side, from surveillance, that was foreign. Domestic, We've had 10 approval recommendations and 7 withhold recommendations in that respect. And that's just one quick metric that we have. So, and that's just what's done. I can't tell from this. This is a report that gets reported every day up to the commissioner's office. It doesn't speak to what's in process in terms of what we're currently reviewing and making that determination on. So it is an active program that we are ramping up. I moved additional people on detail into that role, and we made certain selections for more permanent people into that role, because it's helping us to make some important decisions around approvability of applications.
Okay, I have a couple of questions that are related for Tony. Number one, what type of additional PPE are being implemented or considered to protect operators and personnel working on site during the pandemic? And how are you managing supply shortages of consumables during the pandemic?
Mm-hmm. Yeah, so from a PPE perspective, and I think that most companies are probably doing very much the same thing. I mean, we will follow guidance from our scientists and clearly listening to the various government advisors as to what we need. So you can imagine everybody's wearing masks, appropriate cleaning around the plant, and again, all this is in documentation, the use of disposable aprons, gloves where appropriate, widespread availability of sanitizers, social distancing. I mean, you name it. It's most of the things, quite frankly, that, there's nothing magic about what we've done versus anybody else has done to essentially make sure people aren't contracting the virus from touching a surface, inhaling it, or getting it in, through any other means for that matter. So nothing particularly unusual there, just making sure that they have all the available PPE to do what they need to do. From a supply shortage perspective, that really was the work that, and again, very proud of our procurement organization who deals with all our suppliers. Not surprisingly, most companies will have some level of business continuity plans where we have, more than one vendor of a particular, say, raw material or some sort of consumables. We will have the appropriate inventory to make sure that if there was a shortage of supply, there is enough to do what we need to do from a critical raw material, a critical consumables perspective. And then, of course, as we saw the pandemic unfolding, those business continuity plans really ramped up and made sure that those suppliers who maybe, for instance, don't just supply the pharmaceutical industry, but supply, other types of industries, would focus on us because of the criticality we have in making medicines. So for me, it really was having the appropriate risk management tools that make sure that we have continuity plans in place and those appropriate supply agreements with critical suppliers already in place even prior to the pandemic. So it really was a matter of switching on those plans rapidly and making sure that we didn't have any shortages, which I'm very pleased to say clearly worked because we didn't have any. So I think those backup plans and risk management tools really worked well.
All right, thank you. I have 2 more for you. Which of the practices implemented to facilitate work during the pandemic you think will continue in the future as good practices?
Mm-hmm. No, it's a really good question on the company itself, as I'm sure as many others are going. What lessons learned can we do from the pandemic that have allowed supply to continue, for quality to continue? And in fact, our results have been amazing during this time. So, I'm very pleased with how they've gone purely from a quality perspective. So for me, I think it is the focus on the front line, removing those distractions, and allowing the operators to have a voice in the way they do their work. It's kind of interesting when you think about who for instance, designs batch records and designs procedures, it can often be somebody in a corporate organization who does so without actually speaking to those who do the job themselves. So I think involving the front line and those who actually do the work in the design of how they do their work and giving them the say and giving them more decision making, I think is something that we will definitely include moving forward. We're having a big focus, for instance, in the company around human performance and how we can enable that to improve. And much of it is seeing what actually gets done as opposed to just what is in a procedure. And it's the front line that knows that best. So focus on the operators. I think the incorporation of digital and the rapid way we incorporated digital is not going to go away. As I mentioned, it's done so well, for instance, with things like using augmented reality for tech transfers, that people have actually said it was a better way of doing it. That being able to watch somebody physically in a laboratory in the sending site for a method, watching how they're doing it, using these glasses, being able to see what they do, to be able to speak to them as they're doing it, see all those tips of how they do it that isn't always included, for instance, in a procedure. And then the sending site can watch the person in the receiving site lab actually doing it and watching how they're doing the tests themselves. It's just easier than getting somebody on a plane and just sending them there, because you can literally watch it side by side. So I think things like virtual reality, even these types of meetings that we're having here, I think are not going to go away in future. And just having a more flexible workforce. So having a balance between working from home and working in offices, I think is probably going to change in the whole world that we're living in. Because, you know, for instance, sustainability, people don't have to get in their cars every single day and commute to work if they can do their jobs appropriately at home. So for me, focus on the operators will continue, absolutely, hearing their voice, them being part of continuous improvement, and the implementation of these digital tools has made such a huge difference that, if anything, we're probably going to adopt even more of them moving forward.
Thank you. Alonso, we have, I believe, an interesting question here. To what extent do the agency will go in terms of reviewing non-GMP / administration activities during the inspection during pandemic, such as increased cleaning, social distancing, etc.?
Well, as you know, that's not a mandate on what FDA, what my inspectorate would be looking at. We do, as part of sort of our pre-announcement sort of script, we would ask about those things, but we would not be enforcing, and I'm doing this in air quotes, enforcing social distancing as part of a GMP issue at a manufacturing site. Obviously, even the way we go about conducting the inspection, you know, everything we're trying to create, doing as much off-site activities as possible to help promote that. But we would not be tying a GMP issue to a social distancing issue as the example. I mentioned earlier, and it popped up when I was talking before about sort of the matrix model, so to get these reports. So right now, 75% of the counties are showing as red. It's about a 1% decrease from the last time it was run, which would have been Tuesday. Yellow is about 16%, which is no change. And green is about 9%, which is up 1%. And just, and something I didn't want to mention before, but I see it in a nice update here. Puerto Rico is treated as one. So it's just like considered one. So it had been status of red for quite a while. On this report, I see that it is the current status showing as yellow. I mention that now because now that gives us an opportunity to sort of begin prioritize inspections within the island. Doesn't mean that today somebody's going to be knocking at your facility door. Again, you will know in advance due to the pre-announcement of facilities. But anyway, I think you had another question, Rafael.
Thank you. Also, another participant wants to know if you think that FDA will be executing inspections by telecommunications for international countries. National inspections.
You cut out yeah. So when we if I'm understanding, if I heard the correct question correctly, you're asking when we will assume international inspections?
Yes. Yes.
Again, a very good question. We have suspended all inspections through the end of this month, through the end of September, and we have not started actively planning. And since we're generally 3 months out, we're probably not going to return to routine surveillance inspections this calendar year. But again, those decisions will be made in the next couple of weeks. Our China office, as you all know, had closed at the onset of the pandemic. It is now beginning to have staff return in the embassy to get back more to its normal staff, not just at FDA, but the other governmental agencies that are in that embassy as well. Earlier today, I was scheduled to meet with staff in our India office, but just to the scheduling, we had to postpone that meeting on that. So I don't have for you right now a timeline as to when we'll begin conducting routine surveillance inspections internationally. I can tell you, as I mentioned earlier, that we will evaluate those inspections deemed mission critical for conduct in that space. And so we have done 2 already internationally, and we do have another one that's scheduled for later on this year in that space.
Okay. Tony, how do you ensure that our people adapt to all of these ways of changing, of working with technology occurring at very high speed? How do you ensure that our people adapt to all of this and does not feel overwhelmed by the rapid changes?
Mm-hmm. It's a really good question. I mean, we can't forget we're dealing with people, and change isn't always easy. So I think I mentioned it before. It was down to communication, and a 2-way communication with people to really explain why we were doing it. So it wasn't just a matter of, okay, this is what we're doing, please get on with it. It was really spending that time to engage with the staff, to have that 2-way conversation, and to ask the questions, are you comfortable with this new technology? You know, I mean, it's kind of interesting that sometimes you feel that people are somewhat scared of new technology, but it's amazing that if you implement it in the right way, I think everybody's embraced it and said, oh, we really do not want to go back. You know, maybe there was some traditional QA folks that feel very comfortable with a piece of paper that felt, well, DocuSign, you know, oh, that's something electronic, you know, does it meet GMPs? But if you explain, which we did around the Part 11 version of DocuSign, that essentially it does exactly the same as what it does when somebody physically just writes on a bit of paper, I think they understood it, because, you know, quality isn't just about blind compliance, it's around the principles of why you do things. And I think if you explain it that way, then everybody all of a sudden became very comfortable with it. So for me, it's down to one thing, it's down to appropriate communication and listening to people and making sure that they're happy with what we're doing, and to allow them to speak up if they're not. I mean, there may be some people who are willing to say, you know, maybe I don't feel comfortable doing this, and having the dialogue and explaining why we felt it was the right thing to do.
Okay, thanks. We are running out of time. We have to close at 11 on time. So first, I would like again to thank you Tony and Alonso. I think you have been excellent as always, and we have enjoyed listening to you. It's rewarding to be able to communicate with people that are so far apart and that speak our language, and I believe people was very anxious to communicate again with the leaders in the world of quality. So we really thank you for your participation. I know you had to make changes on your schedules, and even if you have a half an hour presentation, I know you have to be there a couple of hours before, and so on and so forth. But I'd like also to thank Kisha and Wendy that they have been there all the time. And I want to also thank our Pharmacon team here at the War Room. You don't see us, but there is a lot of rushing around here to keep this flowing. We had a substantial number of issues with people that were not being able to enter. Still at this time, we have about 80% of the participants still online. So that was very good. Thank you for the audience, for the participants. We hope to have future webinars with topics of interest for the industry people. And thank you all. Thank you very much.
Thank you, everyone.
Pleasure.
Okay, thank you.
All right.